Hi folks, different type of video log today. This is Karl-James Langford on channel 01 to 1975, 28th of April 2015. I had a bit of a scare, as I said in my last video log, about the fact that I was having some kind of severe chest pains and maybe intimating that it may have been some kind of heart-related attack. And with all due respect to everything, I should have called the ambulance out on the Monday evening while I was having these severe pains. But it did turn out that on Tuesday I did end up going to work in the afternoon. Bit of pottery work to be amongst people. And then I went to see the doctor, and obviously I gave a class in the evening, so things started to clear up a little bit. I was still in a bit of pain, but the situation was that I actually, in the acting class on the Monday, I actually had an intercostal muscle tear. So I tore up muscle in my rib cage area on my left side. That my doctor basically reassured me that it was something that does happen, that does give severe chest pain in a part of your chest and can give you giddiness, and it was probably that it'll take about 10 days to heal. And the point was, though, that I should not have taken a risk that I'm being told by the experts. I should have phoned the ambulance anyway, just to be sure, because if it had been some kind of heart attack, I wouldn't have woken up the next day. It was bad enough collapsing whilst I was having these chest pains and passing out again in the morning. So I should have got the ambulance straight away. And that's what I'm being told. If you've got any pains in your chest at all, you do, from all sources, without doubt, phone an ambulance. There's no point taking the risk. I took the risk. It turned out to be something that will heal in 10 days, and that's it. But I might not be here now if it was something else. So I thought that basically I've got the British Heart Foundation signs for a heart attack in front of me, and it basically says that the signs to look out for with a heart attack in particular are usually severe pains in the center of the chest. Well, my pains were on the left of the center of the chest, but I still should have called an ambulance. Often feels like a heaviness or tightness. A doctor described that it's almost as if, in lots of cases, that it's almost as if your chest is tightening and getting so severely tight. In that case, you phone an ambulance straight away, no matter what you think. And it then may spread to affect your arms, your throat, your neck, your jaw, your back, your abdomen, basically disinhibiting yourself. So, you know, before you even got to that stage, you should have called an ambulance. I should have called an ambulance. The person may also be pale and sweaty, sick or lightheaded. Yeah, I was definitely that. And short of breath. Yeah. So all those things, or any combination of those things, or just the fact that your chest is really tightening all of a sudden, or just after some exertion, phone an ambulance. And what I have been doing is carrying around aspirins with me, and I'm going to make more of a note about carrying an aspirin with me. This isn't come from a doctor, but I'm told that you should swallow a couple of aspirins as soon as you think you're getting a heart attack, and whilst you're calling an ambulance, or you should chew an aspirin. Apparently that sort of off-puts the effects for a little bit, giving you that little extra time to get things organised. And I'm told that also, this is probably folklore, that you've got about 10 seconds before you're totally overcome. So if you've got your mobile there, you've got That's probably just enough time to phone 999. Try to get to the front door, and whilst doing all that, put an aspirin in your mouth, phone an ambulance. That's not going to be always possible, okay? But try and keep something around you so you can just get help. And I think when you're treating anybody who you think's on the ground and they are having a heart attack or are suspected, it's always best that you know what you're doing, and to go to first aid courses. And if you do know anything, then approach the person with care. And don't put yourself at risk, because you might be needed more than anything to get the ambulance sorted and stuff. Is the person conscious? Gently shake and shout loudly, "Are you okay?" If no response, shout for help. Try and get the air flowing into the body. That's the thing. You need to keep the brain working. Okay, and that's very important. And to get the air into the body and flowing, and to get the heart, try and get the heart moving. So obviously tilting the head back and lifting the chin whilst they're in a position on the floor. Look, listen, and feel for signs of normal breathing. If there are signs of breathing, place the person in a recovery position. But if you don't hear signs of breathing, then you need to know a little bit about CPR. I got this little bit of a little leaflet in front of me, so I always carry this with me. So I try and whip this out. So place the heel of one hand in the center of the person's chest and the heel of the other hand on top. Interlock the fingers. Depress and release the breastbone 4 to 5 centimeters. So pushing in, really push in 4 to 5 centimeters. And you watch these programs where people breaking ribs and stuff and all the rest of it. But do it 30 times. But the main thing is to keep the person alive, to try and get the person alive. If you know what to do, then you save somebody's life. And do this at the rate of about 100 per minute. That's almost 2 per second. Okay, so you know you've got to try and get the person up and moving, and then you could do the other thing. Give 2 rescue breaths. Open the airway again whilst you're pinching the nose closed. Take a normal breath, make a firm seal around the mouth, and breathe steadily into the person. Make sure a chest rises and falls. So all these things, you know, checking for the person's signs of life. Just hope that the professional gets there as soon as possible. And the thing is, make sure that you don't become exhausted in trying to save the person, because again, you're there to keep the person safe as well. So, hopefully this has helped today, or it's just sort of refresh people in their minds. And thanks for watching the images and listening to me. And anyway, thanks for everybody's support, particularly from Mary and Michelle, and I appreciate it. Thanks, folks. Bye.